If you or someone you love struggles with controlling diabetes, you know the daily testing can be a hassle. It can be painful and it can also be expensive. But what if I told you that it doesn't have to be that way? Here to shed some light this morning is Kathy Pereira, Vice President of Sales and Marketing for Omnis Health. Hey, Kathy, good morning.
Good morning. How are you?
I am good. You know, November is American Diabetes Month, and it's interesting because it appears that diabetes is as big a problem as ever.
It is. Unfortunately, about 26 million Americans have diabetes right now. That's about 8% of the patient population, which is huge.
8%?
8% of the U.S. population has diabetes. 7 million of them actually are walking around, patients that don't even understand or know that they have diabetes. So
they may be experiencing symptoms, but not really knowing what it is.
Exactly. And unfortunately, diabetes is kind of the centerfold for everything in terms of comorbidities that exit out. So when you're looking at a stroke, that was a complication of diabetes. If you're looking at things like not being able to feel in your fingertips or in your toes, that might be diabetic neuropathy. So those patients may be experiencing symptoms and not understanding that they have diabetes itself.
So let me ask you, what is diabetes testing usually like for people?
Well, diabetes testing can be cumbersome. You know, at times it can be a challenge. Folks are not only managing their diabetes by diet and exercise, but they're also doing it by their blood glucose value. So they may be testing 2, 3, 4 times a day.
Pricking their finger?
Pricking their finger,
Ugh.
yeah, which is painful.
Yeah.
And so for a patient to be able to continue to use a product or to be attached to a product, they really want that product to be ease of use. They really want it to be simple, something that's not hard to do, because they have to do it so many times during the day.
And I think in this day and age, people are really looking for that kind of all-in-one solution if they can find it. And I know that you've got a product right here. Tell me a little bit about this product.
You do, you're right. EVO, allows that discreteness to diabetes. It's a fully featured meter, which means that the patient isn't sacrificing any of the bells and whistles of a regular fully featured meter. So it's going to be all-inclusive in one package. You'll have a 50-count vial of test strips, which in of itself is about a $29.99 value in the case. You'll have a meter, you'll have a control solution, a lancing device, and a 50-count vial of test strips.
That's also big too.
Yes, very much so.
50-count vial of test strips. So what's different about this?
Really what's different about EVO is we're putting it on shelf at a reimbursement price point that would make sense to the consumer. With everything moving on board with different reimbursements, whether it be Medicare or commercial insurance, patients are finding it harder and harder to pull out of pocket to be able to choose between their grocery bill and their health care bill. And we're hoping that we're able to provide something on shelf that will not have to have that decision.
So when we talk about this, and what are we looking at in terms of price point, more or less?
Sure. So on shelf, you can look at some of the products could be anywhere between $96 for a 50-count vial of test strips. The next closest brand is about $29.99, and we're looking at shelving this on shelf for $9.99.
Wow.
So that's a huge cost savings to a patient.
Absolutely. I think patients will appreciate that. And I don't want you to go anywhere. Stay right where you are, because when we come back, we're going to talk a little more about ways to manage diabetes for a longer, healthier life. So don't go anywhere, and don't you go anywhere. Keep watching The Balancing Act. Welcome back. We're talking with Kathy Pereira, Vice President of Sales and Marketing for Omnis Health. And I know, Kathy, you started by telling us about the Embrace EVO meter before the break, and you said that it's the only compact meter available that is inclusive with the 50 test strips. So what do you mean by that, and how does that help people better manage their diabetes?
Well, all the competitors out on the market right now in terms of choice only include a 10-count vial of test strips. So with us including a 50-count vial, it allows the patient to extend out their testing time, which means they're going to be able to extend out their value in terms of what they're paying for the product.
When you have something all-inclusive, everything you need is there.
That's right. It becomes an ocean. I mean, you're walking in aisle 13, trying to decide if you're newly diagnosed. Where do I go? What do I do? Which one do I pick first? And so we wanted to be able to provide the consumer to say, here's a meter, here's a vial of test strips, here's a lancing device, here's lancets, here's control solution, here's everything that you're going to need functioning within the box so that you're not having left to wonder, where do I go? What else do I need to do?
And with people these days, time is of the essence, especially if you're a busy working mom like a lot of our viewers out there. And it makes me think too, because one of the things I know that I can be a little guilty of is always taking care of other people, right? I'm taking care of my kids, I'm taking care of my husband, I'm making sure they're okay.
That's right.
But I'm not really maybe taking as good a care of myself as I can. And I'm sure that's something you can relate to. You've got an 8-year-old,
I
right?
do.
So you know, and I know that it can be hard.
It is. I have an 8-year-old little girl. And again, if you go back and you look at statistics, 215,000 of those diabetes patients are under the age of 20.
What?
Under the age of 20.
Wow.
So that's, considered type 1 diabetes. Type 1 diabetes is going to be, you're born with that disease and they're having to manage that on a daily basis since they've been little. So pricking yourself 2, 3, 4 times a day, sometimes up to 10 times a day for that patient population can be a lot. And so one of the things you want to make certain is that you're providing that product to them that's going to be ease of use. You really want it to be simple and easy for them to use.
And so what can people do today who have diabetes? What can they do to stay healthy?
Well, the most important thing is obviously maintain a good doctor-patient relationship. Your doctor is going to be your best friend in relationship to diabetes. But eating healthy, and looking at the choices that you're making seems very simplistic, but when your pancreas starts to shut down and you're not making as much insulin as you should be, it really becomes critical to understand the food that you're putting in your mouth. And right now it's less carbs, the typical stay away from the bread, stay away from the whites, and look more towards the whole grains and look more towards the fruits and the vegetables.
And all the more important when you have a family history. And you and I were talking about your family has a history of diabetes. And with an 8-year-old little girl now, you want to make sure that maybe that history, we can kind of stop that.
Absolutely. You're so heightened to say, okay, with that type of family history and that hereditary going on, you're looking at it saying, wow, I have to make better choices for her. I have to make sure she understands how much exercise to go get. So we're working soccer on Mondays and working horseback riding, Tuesday, Wednesday, Thursday. So
Important. So where can viewers pick up the Embrace EVO right now today, in case they were wondering?
Right now, I would really like for them to go to omnishealth.com and we can point them in the right direction, whether that be a mail order partner or a retail partner where they can get the product.
Well, I have to tell you, terrific advice. So great to meet you.
It was so nice to meet you too.
Thank you for coming by.
Having me.
Absolutely. I think this is a terrific segment, especially now during American Diabetes Month. And so if you would like more information about innovations in diabetes testing, simply log on to the website. It's omnishealth.com. That's omnis, O-M-N-I-S, health.com.